I've been in a meeting this morning that has told me that the numbers of people in hospital who have COVID is rising quite rapidly now. So that's the reason why we're in tier two. I don't know that we will be in tier two indefinitely. I think there will be great pressure on us to move into tier three from the government in the coming days.
Okay, so do you think we are already delayed? The government is already delayed in taking this decision. Had it been taken a little earlier, or at least Nottingham and the county had been put into some more restrictions a bit earlier, the situations would have been different for us?
I think that's a good question. I mean, last week, beginning of last week, we realised our numbers were going up, and we asked the government for some help with that and some restrictions, and we were told that there was going to be restrictions put in a week ago today, last Thursday, but then we knew that the government were making this big announcement on Monday, and it's sad because Nottingham didn't seem to fit into the government's timetable, so they didn't do anything until this week. Now, we as the county council and the city council got together last week and said we can't enforce this, but we can encourage our residents to not mix with other households, which is obviously a restriction that is similar to the tier two high level regulations the government's put in. So we did advise people of that last week, but you're right, those restrictions have not come in from government until yesterday, and it's probably wasted a week. And
yes,
a week in COVID terms is literally a matter of life and death.
True. So carrying it from there, do you think if the things start to look grave, further restrictions will be put forth by the council themselves for the city and the county, some more restrictions?
We can't do that in an enforceable way. We can have a recommendation, but we can't do it. I would want to give the chance for tier two to have some effect. It's only been in place for a day or so. We need to do that. We also need to think about our economy and what tier three would mean for businesses, particularly in the hospitality industry. So we will be in talks about that, I am sure. But what I would say is we need to make sure that people in Nottingham are adhering to the tier two regulations. You shouldn't be visiting other people in their homes, even if they are part of your family, unless they are in your social bubble. It's difficult, but you need to adhere to that. You must be wearing your mask when you go into a shop or into a takeaway or on the tram or on the bus. And we must be washing our hands and staying the distance away from each other. All those things which we've known since March are all the more important now.
Yes, very much. I have another very important question to ask. It is, what about the travel? Is the city and the county allowing people to travel in and out of the city and the county as normally as it would have been done 2 months back, a month back? Or are there any further restrictions? We don't see anything, but what is the risk of that, to keep doing as normally as we were doing a month back from now?
I think it depends on the reason for your travel. I think as a general advice would say don't travel unless you need to, and you shouldn't be going to visit somebody, for example, in Derbyshire just because they are at a lower level of risk. Because we are from a high level, we should adhere to that rule wherever we are. So if you're travelling to visit family, it doesn't matter whether it's in Nottingham or in Derby, you shouldn't be doing it unless they're part of your household. So I think travel needs to be at a minimum. Obviously, there are some emergency situations where you have to go. If you're attending a funeral, although the numbers are restricted, obviously you have to go to that. If you're in a caring responsibility, you might have to do that. But those opportunities, they shouldn't be casual or just social reasons.
Yeah. There's another question that comes to my mind just now. That is, there's a huge disparity between the numbers when we compare the city to the county. Nottingham City has a much higher rate of infection. It is probably, as of 2nd October, it was 900 plus for every 100,000 people. Whereas the county has something between 90 and 290 for every 100,000. Yet, same regulations are being implied on both the areas. What do we understand from that?
Well, first of all, rates are changing.
Okay.
2 weeks ago, we were about 100, and now we're over 900, as you say. But equally, areas like Gedling and Rushcliffe are also changing and are approaching, if not going over 300, which is higher than the level Leicester were in when they went into lockdown. So it's not just about responding to what's going on today, it's trying to prevent what might happen tomorrow. And I think in Nottingham, people move in and out of the city very readily for work, for study. And so places like West Bridgeford or Arnold or Beeston, people think that is part of Nottingham City, and it isn't. It's part of the county. And we need to prevent things happening. And that's why the leader of the county council and leaders of district councils and myself agreed at the end of last week we would put this advice out to people, which is now being put into government regulation.
Okay, then one other thing is that Nottingham itself houses 50,000 students. With 50,000 students in Nottingham, how is Tier 2 going to be helpful?
It's difficult, you're right, to draw attention to the fact that we have an influx of 50,000 young people, and it's right to say that they have featured quite highly amongst the new cases, and we are working closely with the universities. I've got a meeting with both vice chancellors of the universities tomorrow, because it's not the students' fault, this government policy to bring them back, but they live in big houses or in halls of residence where it's very difficult to self-isolate. Obviously, the restrictions on the pubs and clubs being open not only until 10 o'clock, which is helpful for young people in terms of trying to model behaviour which will help the virus not to spread. But there is still concern for that group of the population, and then how they mix with older people, either in supermarkets or on the tram or on the buses. That's why the masks are so important in those circumstances.
There's been a looming question continuously for all these months, particularly when the government put this 10 o'clock curfew on pubs, restaurants and all. It was funny, but people did ask, will that really help? 10 o'clock, why 10 o'clock? I mean, do you think people will not get drunk by 10 o'clock? Or, I mean, how can we believe that they will stick to a very good behavior just till 10 o'clock?
I think that's a good question. I'm not so convinced that the 10 o'clock policy has been a good one, because what happens is everybody comes out at the same time, and the tram and the bus at 10 past 10 is very busy, and rather than people going home at different times in the evening, some 9, some 10, some 11, maybe some later, they're all put to the same point together. And that's why last weekend we had police officers on the trams asking people with no mask to leave the tram. I'm not convinced that the 10 o'clock curfew has made a big difference.
I think many in the city or living in the city and county are not convinced either. We don't understand it. We don't understand the rule. But yes, we know we have to adhere to it.
Rule.
Yeah.
It is the rule. We need to adhere to it. That applies to shops, to takeaways, to restaurants, to pubs. Everybody's under the same rules. And I think what we're trying to do is to minimize the time that people can spend together and infecting, because this is passed from person to person in the community, and there are lots of times when you might get in a queue for a bus or a queue for a takeaway or a queue for a supermarket, and those, if you're not careful, those can be times when the virus is transmitted.
Yeah, so is the council thinking about writing to the government or doing anything, because it looks like the numbers are rising by the hour. So do you think anything special will be done in this case, so Nottingham and the county follows a different rule from now on? Is there anything that can be done, really?
Well, there is talks going on, particularly with Public Health England and our Director of Public Health, about whether Nottingham needs to move to higher restrictions. We want to give these restrictions a chance to work, but we don't want to be irresponsible in not going to a higher level if that's what's needed. I did write to the Chancellor of the Exchequer on Wednesday to say even Tier 2 is going to affect our businesses. If you can only go out for a meal with members of your household, that's going to limit the number of people in our restaurants, in our pubs. And so therefore these businesses need support. I haven't had a response as yet.
Yes, I did. Your letter was published, and I think many of us read that, and we understood that the council is doing a lot to think about the small businesses. And yes, that on one hand there is this question of the sustainability of the small businesses. On the other is the risk of the spread of the virus. It is really difficult to balance it. But what is your take on it? What are you and the other members of the council deciding on? How are you going to balance it?
Well, by taking advice, by listening to what happens elsewhere, by doing our very best to respond. And you're right, we can't please everybody with this. Some businesses would like no restrictions. Some people would like stronger restrictions. We're trying to balance everybody's need here.
So the restrictions have been put on pubs, restaurants, and other and takeaways. But does it apply for other businesses as well, like the big groceries, the supermarkets? Do they have to adhere to it too?
I'm not absolutely,
because we are not very clear about it. We have to check on their websites to figure out, then we do not know why they are open and the others are not. It's quite a confusing situation at the moment.
Yes. I suppose because the rules are that if you're in a supermarket, you must wear a mask and you must space out, then it's not the same as being in a place where you're eating, where obviously you have to take your mask off to eat. So.
Lately, there have been few complaints about students roaming around in some of the supermarkets and touching things which obviously nobody can restrict, but touching things which they did not really need to, while others are behaving more responsibly, some are not. So you cannot stop people from picking up things from the aisle and then putting it back uselessly, reasonlessly. That's on good behavior. But is the council or the NHS thinking about some protocols to be put in? This kind of reckless behavior would just increase our risk of COVID. Something to be done about it? There's been a lot of talk about it, that the students have come in, they're just about spreading it, they don't care because they are very young, they should understand. So, it's quite a chaos now.
Well, we don't get to run supermarkets. We can put in regulations where, for example, they're not observing food safety or hygiene, those kind of things, and regular visits are made to businesses. And sometimes businesses have to do something as a result of those visits. I would still, if you pick up things and put them down again, generally that's not a good thing to do. But, I know a lot of people, when they get their shopping home now, they're perhaps washing the fruit and vegetables much more carefully before they eat them, those kind of things.
And would you give us a little idea about what the NHS looks like at the minute? What are the plans? I just about read today morning that the council has been in words for keeping the bodies if there was an extra load. So a special place has been allotted, although we do not know the address of it. So that is quite good an effort. But as for our hospitals and NHS preparation, how does it look like to you?
Well, if you're just talking about mortuary space, during obviously the last the last peak, we had to work with the county council to secure further space. Thankfully, we're not having many deaths at the moment, but we do think that the numbers of people in hospital, there's over 100 people in the Nottingham hospitals with COVID now. Some of them will get better, but some of them sadly won't. And obviously we need to provide, that is not under pressure at the moment, but our hospitals are getting more busy than they were. And obviously, because of the rate of the virus increasing, there are members of staff, both from the council and the NHS, who are off work because they themselves are either ill or they're isolating.
Okay. Coming to the perspective of businesses, all the businesses, small or large, what is your anticipation of the effect of Tier 2 on businesses in Nottingham and Nottingham County?
I think it's very difficult for businesses. They've already had a time where they might have furloughed their staff or might have been closed. They've worked hard to make their businesses more COVID secure. And for now to have further restrictions is very difficult, and that's part of the reason why I have written to the Chancellor this week to ask for support for our businesses. Last time we were able to administer over £50 million of grants to businesses in Nottingham. We know how to do that, and we will do it again if the money is made available, but we haven't got the money ourselves.
When you talk about last time, the first time COVID hit us, during that time, a lot was done for businesses, but the businesses which were registered with business rates received approximately £10,000, whereas those sharing an office space or service offices, the businesses which were working from service offices, received nearly 1/4 of that amount, which was not sufficient. What do you think will be your take this time? How can you balance it better?
They were two schemes that were directed by the government, and we administered them, and we tried to be as flexible as we possibly could. So, for example, we managed to secure business grants to market traders in the way that maybe other areas they didn't. But the government had certain rules, and we could only flex it so far. And I can understand why some people felt they were shortchanged by that. That was the regulation. The first grants were only for people who were paying business rates. For people who didn't pay that, they did get less. You're quite right. I have to say I've got about 2 minutes, then I need to go.
Okay, my last question to you is about from the perspective of job retention and new jobs in the market. What will be Nottingham City Council's stand in protecting the situation from further degeneration? It has already degenerated a lot. What is?
I agree. The last thing people want to do is to lose their job, particularly at this time of year leading up to Christmas, where there are less jobs about. And that's why we want to support our businesses. That's why, although the second furlough scheme is not nearly as generous as the first, it might be better than nothing. It might help some businesses, but we want to keep our businesses open as much as we possibly can in a safe way.
But about new jobs, there are many who are just waiting for that.
There are some new jobs coming to Nottingham. Obviously, we've got the Her Majesty's Tax and Revenue offices near the station. We've got other businesses coming, and there will be some new jobs, but sadly they're matched by businesses who are going out of business at the moment and not struggling. So it is a very difficult thing. We do spend quite a lot of money on jobs and our job hub to try and help people to get into work. There are more jobs at places like East Midlands Airport, which isn't easy to get to, but their freight arrangement is growing by the week, really. So there are jobs out there, and we want to attract more investment to Nottingham and to the East Midlands so that more businesses will be attracted to come here so that people can get jobs in them.
Best of luck for all your efforts, David. It has been wonderful talking to you. We wanted to hear from you exactly about what the restrictions mean to us. Thank you so very much. To all the listeners of Voice, you have listened to David Mellen, the leader of City Council, Councillor David Mellen. He explained it to us what the restrictions mean for Nottingham and Nottinghamshire. The situation will not improve in a day, but the onus is on us to be well behaved. Now, what does that well behaved means? Well, as we had always heard in our schools, well behaved would mean following the rules. So following rules would mean wearing a mask every time and each time you go out of your house. Washing your hands very, very regularly, and particularly for 2 minutes. Well, there is nothing less than 2 minutes. Then using hand sanitizer where washing is not possible. Wearing a face visor where applicable. Keeping safe distance 2 meters from the other person, however much you know them. If they are not from your family, not from the household that you are living in at the minute, not living under the same roof, then that distance would help. Well, we do not know exactly how much, but at the minute it is our utmost duty to follow all these rules and to be a good citizen, to be a good resident of the city and the county, to curb on what is going out of hands. The rules have been put in to test, and we will have to prove that we are worthy of it. We should not be going into tier 3, because going into tier 3 would mean further disaster. Well, those who sit back at home do not really get to feel it, but think of the businesses, think of the households who benefit from their people working in those businesses. Well, we have to think about everybody. Thinking about your own self will not do us any good. Travel as less as possible. Now, I have got just 4 minutes. In those 4 minutes, I would like to do a bit of a translation of what my communication with David meant. डेविड मेलन, जो कि काउंसिलर लीडर हैं सिटी काउंसिल के, उन्होंने बताया हमें कि रेस्ट्रिक्शंस, टियर 2 रेस्ट्रिक्शंस नॉटिंघम और नॉटिंघम काउंटी के लिए क्या मायने रखते हैं, उसके क्या मतलब हैं। उसका मतलब सिर्फ यही है कि हम आपको प्रोटेक्ट करने की पूरी कोशिश की जा रही है। क्या इससे पहले लागू हो जाना चाहिए था? क्या इससे कोई बेनिफिट होने वाला है? ऐसे कई सवाल हमारे मन में उठ रहे हैं और आपके मन में भी उठ सकते हैं। लेकिन जब हम ये सवाल पूछ रहे हैं अपने आप से, एक दूसरों से, हमें ध्यान रखना है कि हमें पहले जो रेस्ट्रिक्शन बताए गए हैं हम उन्हें फॉलो करें और फिर ये सवाल करें। हो सकता है कि अगर हमने रेस्ट्रिक्शंस पूरी तरह से और पूरी ईमानदारी के साथ मान ली, तो ये जो रेट रोज के रोज हर घंटे बढ़ते जा रहे हैं वो थोड़ा सा रुके या कम हो जाए, और इससे फायदा सिर्फ हमारा अपना है। देखिए, ये जो रेस्ट्रिक्शंस लागू हुए हैं उनसे सबको बहुत ही नुकसान हो रहा है। आपको लगता होगा बिजनेसेस, पब्स, रेस्टोरेंट्स, टेकअवेज, इनके रात के 10 बजे बंद हो जाने से आपको बहुत ज़्यादा फर्क नहीं पड़ रहा है। लेकिन कुछ परिवार ऐसे हैं जिन पर बहुत ही विपद आ पड़ी है, बहुत ज़्यादा प्रॉब्लम्स उन्हें फेस करने पड़ रहे हैं। और फॉर द कॉज ऑफ ह्यूमैनिटी हमें ये सोचकर वेल बिहेव्ड हो जाना चाहिए। अच्छा, जैसे कि कहा जा रहा है कि ज़्यादा या फिर अगर ज़रूरत नहीं है तो ट्रैवल मत करें। इससे आपका फायदा है, इससे दूसरों का फायदा है। सबसे बड़ी बात समझने वाली ये है कि ये जो ट्रैवल करने से अगर आप एसिम्टोमेटिक हैं, आपके अंदर कोई सिम्टम्स दिखाई नहीं दे रहे हैं, क्योंकि हो सकता है कि आपकी जो इम्यूनिटी है वो बहुत ही स्ट्रांग है, बेस्ट ऑफ लक फॉर दैट। विटामिन सी खाते रहिए, और फ्रूट्स जिनमें विटामिन सी ज़्यादा है वो भी आप लेते रहिए। लेकिन एक बात सोचिए, अगर आपका कोई आपके घर का कोई बुजुर्ग बाहर गया है फॉर सम रीज़न, और किसी ऐसे ही एसिम्टोमेटिक इंसान ने लापरवाही से उन तक पास ऑन कर दिया ये कोविड का जर्म, और वो बीमार पड़े, तो आपकी हालत क्या होने वाली है? अपनों का सोचकर खुद को थोड़ा रेस्ट्रिक्ट कर लेना ही ह्यूमैनिटी कहा जाता है। यही इंसानियत है, और इंसानियत के नाते एटलीस्ट ये हमारा कर्तव्य बनता है, ये हमारी जिम्मेदारी बनती है कि हम वेल बिहेव्ड, रेस्ट्रिक्शंस मानने वाले नागरिक बने। ये अभी इंसानियत की ज़रूरत है, और ये हमें समझना होगा। डेविड ने ये भी बताया कि पिछली बार बिजनेसेस के लिए जिस तरह के फंड्स रिलीज किए गए थे, उसी तरह के फंड्स उन्होंने रिक्वेस्ट किया है चांसलर ऋषि सुनक से कि इस बार भी दिए जाएं, नॉटिंघम और नॉटिंघम काउंटी के बिजनेसेस को इसका बेनिफिट मिले, क्योंकि ऐसा हो सकता है कि वैसे भी मतलब टियर 2 अपने आप में काफ़ी डैमेज कर रहा है, और अगर बाय एनी चांस हम टियर 3 में पहुंच जाते हैं तो कई सारे बिजनेसेस फिर बंद हो जाएंगे, हम पूरी तरह लॉकडाउन में चले जाएंगे, और इसका जो इम्पैक्ट है बिजनेसेस पर वो बहुत ही भारी होने वाला है, बहुत ही बुरा इम्पैक्ट होने वाला है उस पर। तो ये ज़रूरी है कि फिर से गवर्नमेंट नॉटिंघम और नॉटिंघम शायर की तरफ देखे, समझे क्या हो रहा है, और हेल्प करे बिजनेसेस को। डेविड का मानना है कि इस बार शायद पिछली बार से सिचुएशन थोड़ा अलग हो। उन्होंने पहले भी कोशिश की है फर्स्ट स्पाइक के टाइम पर कि जितना हो सके बिजनेसेस को हेल्प किया जाए विदाउट कीपिंग मच डिस्पैरिटी, और शायद इस बार भी उनकी ऐसी ही कोशिश होगी, इफ नॉट मोर। तो इन्हीं उम्मीदों के साथ आज का यहाँ का शो वॉइस मैं खत्म करती हूँ। अ गुड बाय फ्रॉम अनु। स्टे सेफ, स्टे हेल्दी।